Hello, I'm Dr. Daria Brzezinski, and you're watching What Wise Women Want, here on Charlottesville's Public Access Comcast Channel 13. Every week, we bring you panels of women to discuss topics that you're interested in. Hopefully, this will help you make informed choices for yourself, your family, your children, and your community. Ladies, we're 52% of the population with 85% of the purchasing power. Let's use that power to make choices for all of us. If you'd like to learn more about the topics that we discuss from week to week, or the women we have on the panel, you're welcome to visit our website at www.whatwisewomenwant.com. And remember, Wize is spelled with a Z. Also, there it tells you the topics that will be here from week to week. So if you have questions you'd like to ask the panel, because we tape 1 week in advance, you are welcome to send us an email with your questions, and hopefully we will cover it on the air. We also have fireside chats at City Space every third Saturday of the month. This week, our topic is the Affordable Care Act. And what I thought I would do is get different perspectives for you in order to be able to understand it. Frankly, I don't understand it. So we have the law, the insurance, the tax, and the medical perspectives here today. To my right, our first panelist is Libby Edwards Allbaugh, who is principal of the Tax Ladies. To her right is Paula Tomko, Chief Operations Officer of the Central Virginia Health Services. Then we have Dottie Allen, who's principal of RiverCross Group and works locally here with the Towe Insurance Company. And finally, Mary Bauer, who's Director of Advocacy at the Legal Aid Center. Thank you, ladies, for joining us. Now, we want to know in a very short summation, what is the Affordable Care Act from your perspective? And we're going to start with Mary.
There are 46 million uninsured Americans, and the Affordable Care Act is the largest effort in U.S. history to extend insurance coverage. And that means that there will be new, affordable options for people who have not had health insurance, for millions of people. All insurance companies will have to comply with some minimum standards and offer certain benefits. The financial help is available to help people with their budget, and people cannot be turned away for health insurance because of pre-existing conditions. So this is a huge step forward in our perspective from as lawyers for poor people to get people covered.
Okay, so that's from the law perspective then.
From the legal aid office perspective of people who are representing low-income people, that this is a real opportunity for people to have health care coverage.
Who haven't had it before. Mm-hmm. Dottie, how about from your perspective from the insurance?
From my perspective, there is a little over 1 million Virginians who are currently uninsured. And for those, they will have to make some decisions. Now, right now, on the individual side, they have options, but for businesses, because I do work with businesses, they have some decisions that they have to make. Do they want to continue offering coverage to their employees? Some of them may be better going and getting the insurance through the exchanges. So these are decisions that the business owners are going to have to make, and how that impacts each individual. So we see a lot of changes coming for the next year and how it will impact each of us.
Paula, how about you from the medical perspective?
From the medical perspective, we're very excited about it because I work for Community Health Center, and we see a lot of uninsured folks at all different ranges of that, not necessarily just the poor or indigent in that regard, but seeing how many people limit their health care because they don't have coverage when they have to pay full cost. The ability for them to have insurance and be able to get the preventative care that they may have been lacking or ignoring and not taking, to as well as helping folks once they are diagnosed to be able to get them into care to manage chronic diseases much better than they are before is really good news for us.
Okay. Libby, from the tax perspective?
From the tax perspective, everyone is wondering what the bottom line is and what effect is it going to have on me and my pocketbook, especially with the shared responsibility provision, and if they are not
Okay,
insured.
what's the shared responsibility provision?
Well, that is the provision that you have to have the insurance, or when you file your tax return, that there will be penalties if you do not have health insurance. So people who are not currently insured are very concerned about the bottom line and what's that going to look like to them in their pocketbook.
Okay, so if I file my so the way the government figures out who has this and who doesn't is by filing the tax return?
Well, the employers are required now to actually respond to the government as far as to who has insurance, and also the insurance companies are now required to report to the government, and so that's how they're going to figure it out.
Okay, all right.
The reconciliation will be at tax time.
Yes.
I wondered how the government was going to find out whether or not I had insurance if I, didn't go to the hospital, if I do prevention, and I take good care of myself. How is the government ever going to find out whether or not I have insurance or not? And that was actually one of my questions. So there are checks and balances in order to be able to find that out, and that's when you put in your tax return. It's good to know. So what are your roles? Y'all were talking about navigators and counselors, and what are all those terms? Anybody?
Well, at the Legal Aid Justice Center, we represent low-income folks all over the community with legal problems. So people come to us if they get denied Medicaid or any number of other legal issues. But in terms of the Affordable Care Act, we actually have navigators on staff. And you mentioned that term. Navigators are people who are actually certified by the federal government who can help people walk them through their options and help them actually enroll.
Uh-huh. So what constitutes somebody who comes to you? Is it somebody who's unemployed, somebody who's making minimum wage? Who gets to use legal aid services?
Well, for legal aid, we have a certain cutoff, usually about 125% of the poverty level. But under the Affordable Care Act, people can get subsidies up to 400% of the poverty level. And so under that kind of program with our navigators helping people look at their options, we can help people up to 400% of the poverty level. And we can also help small businesses look at their options.
So now you can expand your services, even though legal aid only works with a certain population, you can now work with other people as well?
Under this, to help people walk through their options under the Affordable Care Act, we can.
Okay.
It's given us a broader range of people that we can help, and we're delighted to do that.
So who's a counselor?
Our folks.
Okay.
Well, different folks, there's a lesser level of training, but we're helping just individuals with their process. We're not helping the small businesses, but we can help walk them through their options as well and help them enroll online as well. So those are coming from the community health centers. Most of the community health centers in Virginia all got a grant and have several different people at each of their sites that are able to help walk through the program, but the navigators definitely can help with businesses. They have some more responsibilities with folks where English is not a primary language, I believe, and so there's some other, they have a level, but they take about 20 additional hours, I think, on top of what the counselors do. But so your average person who just needs help navigating, who's looking for insurance for themselves.
Oh,
or their
so an
family.
average person can come to you?
Yes, we do not have any income requirements. As a community health center, we see a lot of uninsured patients because we offer a sliding scale fee. So we were kind of tapped for this as well as the legal aid because we see those patients and already have a relationship with them. So we're able to, start talking with them and help them navigate into the system.
So are you part of the Thomas Jefferson Health District?
Not as far as
Are you private or are you?
We are a private nonprofit, yes.
Oh, so you're a private
But we receive some federal funding to help offer sliding scale fee to uninsured and underinsured.
Okay. So then if they're the navigators and the counselors, what are you all?
Well, the insurance, we are certified to, you have to get a certification, but your insurance agent should be able to assist you as well. Now, a lot of them are getting their certifications in order to sell the insurance on the exchange. You do not have to go direct. You can actually still go to your local insurance agent that you've been dealing with.
Okay.
Or know locally. So those.
Yeah, and I would be the reporter at the end, kind of doing your checks and balances out. But on the back end, on the front end, then we are we're the planner, letting people know what the ramifications, and if they need to see the other folks so that when it comes to the back end, there's not issues.
Okay, let's start from the, go ahead.
Well, to her point is that people have to realize that this is a tax credit. So you have to estimate what you're going to be making for 2014, and how many of us do know what we're going to make in 2014. So
What does that mean, a tax credit? I mean, if I make, let's say I make $30,000 a year, what does it mean to get a tax credit?
Well, right now, the way that it's set up is the tax credit is going to be up to 400% of the poverty level, which is very generous. And a lot of people that don't think
Wait a minute, we keep saying 400%, but
400.
tell people what that equates to in dollars, let's say.
I believe I saw numbers like a family of 400 and 110,000 or something.
94,000. 94,000.
So a family of four making $94,000.
And a lot of times for programs that exist, that would not be a number that they would qualify for any program. So for this particular program, it's nice because they can qualify for the credit. The credit can be gotten upfront to be used to pay the premiums as the year goes on. It's not a end of the year where you have to wait till you file your taxes to get the credit. Or you can file at the end of the year and get it back as a credit. So it's going to help people actually pay for the program as it goes along.
Okay, so go
I was
ahead.
going to say, the numbers we're hearing are for an individual. I think it's 11,000 to 44,000. They would be eligible for
Tax
cost
credit.
sharing and credits. And if a family of four is 23,000 to 94,000 approximately. So
Excellent.
if you're, which like she said is a huge expansion of what these types of programs normally accommodate.
So when I fill out my tax return at the end of the year, it's going to have something on there with regard to this Affordable Care Act, you know, whether or not I have insurance or not, how much I paid in and that kind of thing?
Well, we won't see those forms until
Okay.
a while,
January 2nd, yeah.
but we expect that.
Okay.
We expect that will be a
So
question.
what is better? What is better? Do I pay a high premium or a high deductible in this case? What balances out?
That,
Go ahead.
It's a personal
that's,
thing.
it is.
Yeah.
It's a personal decision. It's
If you have no health care and you're getting health care because of the mandate to have health care, and you're worried about cost, then the high deductible would kind of put you where you are, but at least you have something as opposed to nothing.
Okay, so it would be better to get the higher deductible than, go ahead.
It really depends on
Okay.
what you need out of the service. If you're someone who goes to the doctor quite a bit, if you've been struggling with healthcare but making it or coming to free clinics and things like that, or community health centers, or paying a private doctor, you may want to opt for something that has a lower copay for the office visit because that's something you use a lot. If you really only need catastrophic, you may want to go high deductible. You really need to weigh the options and think about what would you plan to do, what have you been doing if you've been managing on your own without a policy, or I guess even for some folks who have private policies now, they can go back in and look and see if it'll help them. So
That's
they
right.
be able to get a
Exactly.
different plan.
Yeah, and I think that's why there's a real value in having a counselor or a navigator who can walk you through and say, these are the options, this is what, and there are some plans where people effectively pay nothing because of the subsidies.
Wow.
And so,
Wow.
there you might want to say, I want to get as many benefits as I can get, certainly
Right.
if it's not going to cost me anything out of pocket. But there are folks who can walk people through that based on their particular circumstances and say, these are the options, pros and cons, and people have to make their own personal decision about what seems right.
Right.
Because one of the first things that we've talked about with our counselors too is because some of these folks have never been insured, they don't understand what is a
Right.
copay, what's
Right.
a coinsurance
Right.
deductible, what does it mean to stay in network, when am I going to get balanced billed, what does all this mean? And so you do have to have that basic conversation to make sure they understand if they've been someone who's been self-employed and never been able to cover themselves,
Right.
or being insured for the first time as young people often don't know what these terms
Right.
are,
Right.
and those are folks we definitely want to get in the plan and covered
Right.
as well.
So what's an exchange? We keep hearing about exchanges. Does every insurance company get to be part of an exchange, whatever that is?
well, the exchange is.
What is the exchange?
Exchange. It's called the marketplace now.
Excuse me.
That's insurance
yes.
marketplace.
The marketplace.
But what it is, it's the online ability to go and apply for the insurance. You go to healthcare.gov and you will put in the state where you're located, and it will bring up your options. Now, a lot of the insurance companies have opted not to participate in it, so the the options on the exchanges are very limited. So you might find a plan that you want, but it may not be available on the exchanges. So you have to be very careful. If you have insurance now, on the individual side, you can, you don't have to make a change to that until it renews again. Now then you can sit and take a look at, does it make sense to have one of these plans or keep what you have? But if you keep what you have, you're not going to get that tax credit.
And I think it's really important that people know that in order to get the tax credit, it has to be an exchange plan.
It has to be on the exchanges. And some insurance companies are also having their own private exchanges, and you may have heard that. Some of the larger companies are sending, like Trader Joe's, they've sent them to private exchanges. Well, those exchanges are also linked to the state exchange, so you are still able to the federal exchange, so you're able to still get those credits.
So it's a minimal amount of exchanges that are available to us in the state of Virginia.
Right. But right now, depending on where you live is who right now is participating in the exchanges.
Who you live in the state of Virginia? Or
in the state of Virginia, not all carriers are participating throughout the whole state.
There are some regional carriers that have bid in, like in Northern Virginia or Southwest Virginia, that just cover those areas.
But we would urge people who have their own insurance now to look at the marketplace, look at what options are available, see if the plan that they have has provisions that are grandfathered where they're not going to get some of the better protections that are available for new plans, and just compare that and see what is the best deal for them.
And added to that is also, we've talked a lot about the uninsured, but if you are insured and you're paying a lot for your employer benefits, you can also go in and look, and your employer has to verify how much, but there's a certain level.
It's 9.5%.
9.5% of your income has to be the limit for the premium. So if your premium is more than 9.5% of your income, you would qualify to be in the marketplace and be able to get off your employer's coverage.
Oh,
so if you have really
I thought if you had employer insurance, you weren't allowed to be in the
it has
marketplace.
to qualify at the 9.5%.
If it's considered not affordable.
Right, by the employee standard.
And that goes back to businesses making those decisions. Are my employees better going through the exchange or the marketplace, or staying under the plan that I'm providing them?
So if I'm insured at my business and I opt to go to the exchange, then my employer doesn't pay my insurance anymore? Is that correct?
That's correct.
Or does he pay or he or she pay a supplement to my insurance on the exchange?
They can pay a part of it if they set up a special plan. They can set up to pay a portion of that. They can say for each of their employees they're going to give them X amount of dollars towards their health care coverage.
But what you're essentially doing is looking at what you're paying under the employer's provided plan and looking at the marketplace and saying, this is a better deal for me, even if I pay it. And that, for some people it is, because of the subsidies, because of the plans that are available.
Because
going directly through the marketplace may be better than the employer options in some instances.
Because 9.5% is a lot of money out of somebody's paycheck to have to pay towards health care.
See, now I was under the impression that if you had health care with your employer, that you didn't have the ability to be able to go into the exchange.
You can stay where you are, but if it's considered unaffordable and they charge a lot, where the employee's paying a lot of the cost.
Now there's a new one.
It's worth checking into.
Okay.
Right.
So let's start from the bottom. So if I'm on Medicare or Medicaid, how does this affect me?
Well, I mean, they're different. If you Medicare, your benefits are going to be, are not going to change very much. You can still see your doctor. There's some good things that will happen. There's some preventative care that's going to be free.
They're closing that donut hole.
The donut hole that is, people talk about for prescription drug costs over a certain amount, that will be substantially shrunk under the program, and so those are positive benefits. Now, if people have Medicare Advantage and through a private company, those benefits may or may not change depending on what that company does. But essentially for Medicare, benefits continue with some positive developments. Now, Medicaid is a different matter, and one of the things I think we really need to talk about are the number of people who get left out of the story as it is right now in Virginia.
Currently or after the
If we
Affordable
don't
Care?
expand, because Virginia's not choosing to expand Medicaid at this time, they think there's about, 400,000 Virginians that will be in a gap because of their income.
Whoa, that's a lot of people.
Because we're not expanding as a state. We're in
We have
several
one
of
of
the states.
Right, I'm sorry.
Let's go right ahead.
We have one of the stingiest Medicaid programs in the country.
You said
we cap adults at basically people are not eligible over 30% of the poverty level. So that's a
Wow.
ridiculously small, unlivable amount of money. So lots of poor people between 30% and 100% of the poverty level, something like 420,000 people are not eligible for Medicaid now, and they're not eligible for the marketplace.
Whoa, so where
They're
do
not
they
eligible
go?
for
They're gonna be in a
subsidy.
gap.
They're in a
They're
gap
still gonna-
until
So does that mean the free clinic still stays
And
open
this
for
community
those
health centers-
people?
Oh, yes, we'll still be
Definitely.
there. We'll be there.
until Virginia, expands Medicaid as is permissible but optional under the Affordable Care Act. There's going to be, some of the poorest people in the state are not going to be benefited.
And they'll be exempt from the penalty. I mean, they won't be charged
Oh,
a penalty
okay,
either
right.
because
But-
they can't get it because they don't have an option, but they're still left
Wow.
with
Some of the
health
people who
insurance.
need it most,
Yes.
who will be left out because Virginia has not yet chosen to expand Medicaid.
And tell me what that salary or income looks like where they fall into the gap. Do we know?
Let's see.
I
I
think-
think I've got it in, I want to say it's under 11,000.
Under 11,000 per person? Yeah, because you cited that 11,000 mark
I said
earlier,
that.
She's got
so.
it right there with the poverty level, yeah.
Well, for a family of 3, 100% is about $20,000. So 30% would be
two
about
kids?
$7,000 a year. So you'd
Okay.
have to earn less than $7,000 a year for a family of 3 to be eligible for Medicaid. And if you earn more than that,
Goodness.
then we're not covering folks.
Wow.
With the exception of children.
Right. And they think there's about 70,000 children that could be eligible for Medicaid, and we're hoping to get them through the process too, because if you go online and do your application, you will get routed to those services that could give you service. So if you're actually eligible for Medicaid and didn't realize it, it's supposed to route your application to social services, or for some reason you're eligible for Medicare and didn't sign up right, it's supposed to route you there. So we're
So
hoping
are
we
all
can
of your
find-
services free to counsel and to
Yes,
navigate
ours are.
people?
Ours are, all of our services.
Yes.
Okay, and yours as well? Or do you all charge fees for, helping your
No,
clients or
not
what?
for our customers.
No,
No.
okay. All right, so you can get this information from, because I can see how it really may confuse people.
Yes, and like we've said, this is something, you talk about women having the purchasing power. Healthcare decisions are made by the women in the family.
That's
So
right.
whether you're a mom trying to help your 27-year-old son who is clueless about this and you want to get him on board because he just came off your policy because he aged off, or you want to help your mother who's maybe not working but not yet ready for Medicare, you can help them in that regard too. So it really is important for women to understand what this is about because it does affect their
Well,
family.
let's go to start talking about different women's issues. So I'm a single mother with children, and I'm just making it, paycheck to paycheck, working hard, maybe even 2 jobs to support my family. So and maybe I get insurance and maybe I don't from most likely not. I don't get insurance from my employer. So what kind of benefits can I glean from all of this with, such a minimal income? And yet, do the numbers equate when there's one adult and, several children, or?
It goes off family and it goes off family income. So if you're that single mom with young kids, you're only relying on that income. If you're a single mom with teenage kids who work and file taxes, all that income is going to be part of that family income. But it's dependents who live with you who file taxes. That income is going to be used to make that decision. But, the lower end you're at if you're eligible for the market, the more credits we hear. We can talk about that we've been struggling, and you've heard about it, getting online and getting access because so many people are trying to get on and get the information. It's tying up the system. And so we haven't necessarily seen some of those rates, but we did walk through someone that, they haven't made a decision yet, and this isn't for everyone, but it was a 56-year-old woman who made $20,000. She's single, has no dependents, and she was able to get enough credits the tax credit was large enough that it would cover her premium on the bronze plan. She would pay a little bit more if she wanted the silver plan, which has richer benefits. And so we're in the process now of walking that through her, but there is potential that folks can get some help to get good coverage.
So we hear a lot about how this is affecting business, and you two work with businesses. So how, I mean, I've heard all kinds of nightmares on how, businesses are cutting back and only having part-time employees so they don't have to pay their insurance. And
Yeah.
I mean, is this all the media hype, or is this true, or what?
I'll tell you one thing. The first thing is that, yes, the phone started ringing right away. But the first thing is that it affects 50 or more employees. So for most of the customers that I work with, small businesses, it doesn't affect you. So breathe, and on a business level. And it's going to affect you on a personal level. But as far as business, it has no effect. You're going to have some options as far as with your employees and different things that you can do, but as far as penalties or anything for not offering a plan, that's the big thing that a lot of small 10 to 15 employee businesses were really worried about.
Right. So yeah, the businesses, what they're facing is that the insurance companies are asking them to, or giving them the option to actually renew their plan early so that they can keep what they currently have, keep the current ratings, the current rating structure, which is going to be changing come January 1st on the new plans. The current rates are based on age and gender and your medical history. That changes come January 1st. It will be what they call a 1-to-3 ratio, which means if a 20-year-old is paying $100, that 60-year-old is not going to pay any more than $300. Now it's somewhere around 1-to-6, 1-to-10. So you're going to see that change. This $100, correct. It is based on their gender, which means that the young male pays a lot less than a young female. Well, that's changing to the unisex rates. They'll be paying the same. So
And the only because women get pregnant.
That is right. Yeah, that's exactly right. The only thing that they can charge for is smoking. So if you're healthy, you no longer get credits for having good health. If you have medical or pre-existing, they no longer charge you for that. So when we hear, and you may have heard, rate shock, a lot of, especially younger,
What did you say?
rate shock.
Rate shock.
Yeah, because the rates are going to go up quite a bit.
Oh.
And I've seen it. One friend of mine said that his son, for his family, was paying $1,000 a year. He got his new premium. It's going up to $1,700.
Wow.
Yes. So there's, for businesses where they have a family rate, the family rate is going away. It will be rated based on each person in that family. So there's a lot of different factors coming into the new rating structure, which is part of the act and not part of what the insurance company
But this
set
takes
up
us back to the beginning where then you have to go and look at the marketplace, because then there's that 9.5% of your income when your rates are going up that you can possibly get relief within the marketplace.
That's correct.
And can I just follow up briefly on the single mom, because we talked just a little bit about how she may or may not be eligible for subsidies depending on what her income is. But there's some other things that I think are really positive for women under the Affordable Care Act. There's preventative care that has to be covered now that wasn't covered, like mammograms for free, FDA birth control, FDA approved birth control has to be covered. And some things that some insurance companies didn't cover, like pregnancy and newborn care and breastfeeding equipment and support to allow moms to go back to work more easily. Those things are covered now. They have to be covered in new plans. And so for working moms, those can be really huge advantages.
Right, and like in the marketplace, any of the family plans have to have pediatric, dental, and vision screening, which they didn't have before. They have to have substance abuse disorder coverage and mental health benefits, which different policies didn't. So there are definitely, these plans that they'll be able to purchase through the marketplace are plans that provide good coverage.
So these are the ones that are in the exchanges that we're talking about here, not the ones
Well,
that are...
but for all small group plans, they all have to have those.
Oh, they all do now.
They have to have those 10 essential benefits, which include the pediatric vision
Okay,
and
so
dental.
what are the 10 benefits? if you just rattle off the 10.
Hang on,
'cause we're-
I've got 'em.
Oh, good. I'm glad you do.
We're going
Yes,
around.
I don't have them, but
around and
a
around
lot of
here.
the plans now currently have them, and as of August of last year, they had that Women Initiative, which also included the coverage for the birth control that Mary was talking about. So those are things that have been added, at least on the group plans that they have now.
So,
It's on the individual side that we didn't see them necessarily.
okay, so all of the insurance companies then, whether you are an exchange or not, have to follow these certain 10 different.
At least for groups under 50.
For, what is that? For groups under 50.
The employers under 50, correct.
So if I go for an individual plan, they won't necessarily offer that to me.
Well, the individual plans as well, but for employees that have 50 or more employers, they don't necessarily have to have those 10, 10
okay.
essential benefits.
Okay, so it's starting to sound like we're paying for prevention
No,
here.
that's not it.
When you talked about drug addiction and things like, are we paying for starting to pay for prevention strategies here?
We should
And
be.
good health, or no? Is
I
that
think there's definitely preventative things that are covered, and by adding some of these services, yes, you can get people treatment that they would normally have gone without. That
And
could
lots
help.
of them are free under the
so?
plans.
What kind of prevention would be?
Well, your preventative
covered?
screenings, your
I'm sorry?
preventative screenings at the different levels for
Your
different
annual
age group,
checkups.
Your annual checkup.
Vaccinations.
is covered.
vaccinations,
Vaccinations.
immunizations,
Oh.
things like that are
Yes.
covered as part
Okay.
of preventative. As she said, mammograms, which keep a lot of women away, even
Correct.
with Komen grants and things like that. Every woman's life, there's still a lot of people that go uncovered and unchecked.
So the things that I can see why there's so much confusion here, because the difference between the exchanges
Yes.
and the insurance company itself, there seems to be different characteristics and qualities, and it kind of upsets me a little bit that you're no longer getting insured if you're healthy. You don't get the benefit of being healthy. It seems like, did I understand that correctly, or have we
Well, I think
eliminated
it's
that?
also shared risk, like
Okay.
a group insurance, kind of, where everybody in.
And I think that is one benefit, at least from the small businesses, that they'll see, because if they had one person in their group that was not healthy, the whole group paid the same rate, and if that employee left, they still had to keep that same high rate. It's hard to get that rate removed. So I think that is one benefit, but now it won't matter. I mean, everybody will have the same rate.
And that's what I'm
So
saying, it's
it's-
important for the healthy people to get into the program
Back
too, and
into-
not just those
Right.
people who need insurance because they're sick and been struggling.
Right.
So now if you're a healthy person, it doesn't affect the group rate at all. Or if you're a sick person, it
That's
doesn't affect
correct.
the group rate.
Correct.
It's still the same group rate.
Correct.
If you're with an employer.
Correct.
Okay, so how about if I'm a healthy person and I'm buying insurance privately from a private insurer? Is there any changes with regard to a private? We keep talking about, the businesses and the poor and all that, but what if I'm just a regular person with a family and, I've got insurance from my insurance company myself, I don't have it through my business. What happens to me? I mean, how are my payments, how are they qualified?
I mean, you could keep the health insurance that you have.
Okay.
As a person, and you can hold on to that. But we would also encourage you to look at what the other options are, because you might find something that you regard as a better deal, a better package.
But if you
and-
have insurance now that you're happy with, you do not have to make any changes.
Right.
But you need to wait to see what your
Except
rates
by
are going to
time-
be, because your
Right.
rates are going, with the flattening, the rates are going to change. So you really need to.
So if you
So
have
how do I know if my rates are going to change in
You'll know.
January?
Call your insurance agent. Yeah,
Call your insurance agent.
Because if you have a current plan, if you've bought it, if you don't have a plan through your work and you purchased it and it was purchased before March 23rd of 2010, you haven't made any changes, you may be grandfathered and be able to keep that plan. You might like that plan and don't want to change to some of the other options, so it's nice that you can keep it. But if it's not grandfathered, whenever your policy does renew, you're going to have to make a decision. You're not going to be able to keep that policy. you're going to have to renew to one of those plans, which they refer to as the metal plans. So the silver, the
silver, gold.
bronze. Yeah.
All right, to explain now the bronze. So the bronze, silver, and
And I
gold
think that's-
refers to me if I'm an individual who doesn't have insurance with my company, then I get different plans?
Well,
Is
that's
that
what they're
it?
calling the
Yeah.
marketplace. That's how they're tiering the
Okay.
different tiers of
Yes.
coverage
Yes.
that you can pick. And there's also a catastrophic policy that some folks can pick.
For what is catastrophic?
Catastrophic is basically what it says. You don't get much basic coverage, but if something big happens, you'll have coverage. I think they're 30, that's for 30 and unders. Or something. There's some
Yeah, I don't-
qualifications on who
I
can pick
don't-
that.
Yeah, I don't know what they are, but
okay.
Because they don't want you just getting that to meet it and then paying for it and not having it coverage.
So if you haven't had insurance now, let's go to the older people. So you haven't had insurance with anybody, okay? And all of a sudden now you have to go out and buy insurance. Where does that put you, in terms of the marketplace?
It depends on your family income.
Okay, it depends on your income.
Because your family income will decide whether you get in the marketplace and get those shared cost savings or the tax credits that would help you pay for that.
Right, I mean, your example earlier of the
The 50s.
woman in her 50s who basically had no out-of-pocket costs.
And but your minimum Medicare covers the requirement as far as from the government. So if you're getting your Medicare, then it really doesn't. You don't have to go to the marketplace unless
Okay.
you just
Right.
want something else.
So if I'm on, let's say, food stamps and Medicaid, this doesn't affect me.
Correct, you won't make
At
a
all.
change because you're already on Medicaid.
Okay. So, but if I'm in any other category, then all of this affects me.
Then you want to check.
Okay.
Yeah, and if you're on food stamps but not getting Medicaid, I mean, if you're getting other kinds of public benefits, then you may be eligible for a subsidy, or you may not, and you want to check on that. But getting the subsidy isn't going to affect whether you're eligible for those other kinds of benefits. So it's not going to count as income that is
Right, that's
going to
count and then, kick you out of food stamps because you're getting a subsidy for health insurance. It's not going to be counted on that.
Okay. So you all are very knowledgeable and obviously have been trained but I've discovered watching the television and reading the newspapers and all the literature that there is a lot of conflicting information out there. So how do I know that when I go to my insurance agent or my tax person or my medical professional that I'm getting the right information?
There's a lot of information out there. I highly recommend the website that we send people to initially to look at if they're comfortable doing that. And that's www.enroll-virginia.com. And it has a lot of information. And there is bad information out there. So this is available. It's a good resource. You can call our office or the statewide hotline for free. People will talk to you, give you good, solid, reliable, free information.
I think you want to ask the person who you're talking to, what have you done for training? Are you a counselor? Are you a navigator because your insurance agents, brokers and things like that can do it too.
Yes.
So you want to ask your person, what have you done to be knowledgeable? Are they just going through and reading stuff off the web, or have they actually taken the training? They should have their certificate available for you to show that they have completed the course so that they can, at least get you to the right sources. The Enroll Virginia, healthcare.gov. That's where the main information's coming from that's going to be going on your application and things like that. So those are your trustworthy sources, but certainly ask anybody you're talking to, how qualified are you to talk to me about this? What qualifies you to talk to me about this? And make sure, and like we've been talking here with all these different situations, it is important for everyone to go out and ask someone whether you've gotten the policy that you haven't changed for years because you've had it privately. What do I need to know? What do I need to know for next year? How do I get ready? Talk to your insurance person. If you've not insured, you can go to a community health center. You can go to different social service agencies. You can go to the law center. So there's lots of different places that you can go to get qualified information.
Okay.
There's certainly people out there in the world who have kind of their own political view about this that, I'd just be wary of. And there's really good, reliable information that sort of doesn't have an agenda that's just to provide information, and that's what you should look
And that's
for.
exactly what we're telling our counselors when they go to meet in a public group, that this is not to debate whether the laws are right or not, or liked or not. This is the law right now. These are your opportunities under it. This is what you need to make an educated decision. If you choose not to do it and take the penalty, that's your priority, but at least you made the decision in it with an education behind it.
You are listening to What Wise Women Want, and I'm Dr. Daria Brzezinski. We're here on Charlottesville's public access television Comcast Channel 13. And today we're talking about the Affordable Care Act, if you haven't already discovered that. We're here today with several guests who give us a totally different perspective from each of their perspectives on the Affordable Care Act. And they are, to my right, Libby Edwards Allbaugh, who is the principal of the Tax Ladies; Paula Tomko, who is Chief Operating Officer of the Central Virginia Health Services; Dottie Allen, who is the principal at RiverCross Group and the Towe Insurance, works with the Towe Insurance Company; and Mary Bauer, who's Director of Advocacy for Legal Aid Center. Now, let's get back to what we were talking about. My goodness, there's just, I really appreciate that there are, certificates that we can, know that who is being trained in this and who isn't, because I was not aware of the fact that people are getting certificates. So are tax brokers and insurance agents and healthcare professionals and lawyers are all getting these certificates, or yes or no?
Well, insurance, I know that I am certified to sell and counsel for the exchange as well as off the exchange, but to be able to counsel on the exchange, you do have to get your certification.
Okay.
But not all insurance agents are.
Okay.
So yeah, it's good that you do check and make sure that they do have that certificate.
I'm not counseling on the exchange. I'm telling you what the laws are and what ramification it has for you. So my certifications are just my basic tax certifications as far as what I do. And my training is based on IRS training as far as how we handle the regulations and how we report them at the end of the year. So you're not going to come to me and I'm not going to tell you which exchange is better or how to enroll or anything like that. I'm just going to tell you how much you're going to pay if you don't enroll in one of the exchanges.
Okay.
And there's some credits for businesses as well.
Yes.
And so do lawyers
Typically, no. I mean, we
Okay.
have people in our office who are navigators. I am not one of the navigators, but we have people who have gone through a pretty rigorous training. And they really understand how the marketplace works really well. They can really walk people through what their options are. That's not, I mean, lawyers can give kind of general legal advice about this and even represent people in cases if they arise, but and we don't need a specific certification to do that. But in order to be a navigator, there's this kind of training, and you have to pass a test, and you have to have that certification.
One of the terms that gets thrown around in this conversation is the individual mandate. What does that mean? What is an individual mandate? Does anybody?
It's
That you have insurance.
it's requiring the individual, whether you have it through your employer or individually, you have to have insurance, except for the few exceptions, come January 1st.
And that's what the individual mandate is.
That
And then
is.
there
Okay.
are penalties if you do not participate. The first year, they're $95 per adult, $47.50.
Or 1%.
Or 1% of your annual
that
income,
gets
whichever's
left
higher.
off. Yeah, that gets left off quite a bit.
And-
Wait. Let's go back again.
Yeah.
What are the penalties again? So it's $95
Per person, per adult.
per adult a year?
For the first year.
For the first
it
year.
goes up, yeah.
Yeah,
For
or
the
one-
first year?
Or
Or
1% of your annual income.
Or 1% of your
And it's
income?
$47.50 for a child.
A child counts for-
$47.50 per child?
It's half.
And it's the greater of those two, either those individual fees or the 1%.
And how is child defined? How old?
Under 19.
18 and
19.
Well, there's so
Under
much.
19.
Okay, let's stick with the penalties. And so after the first year, what's the penalty?
It's 2% or
It's 2%, $325
per adult.
for adult.
$325 the second year?
Wait till you
Okay.
hear the third year.
What's the,
$695
and it's $695 the third year,
or 2.5%.
Or
or 2.5%. Okay, so let's just say I opt to do the penalty. Like I remember initially when I first moved to Virginia, you could opt out of getting car insurance and just pay, a fee, uninsured motorist fee. Okay, so I decide that I can't afford to pay insurance, and so I'm going to opt out and decide to pay the penalty. Does that make sense? In terms, so what happens to me if I decide $695 the third year is cheaper than my going out to buy insurance? What does that do for me if I have to go to the hospital? What happens?
You'll pay out of pocket the way you do now.
Pay out of pocket.
And you put
and some people don't decide that.
everything at risk. I mean, people right now are one illness or one accident away from complete financial disaster, losing everything they have.
And I think one of the things they talk about a lot, this is designed for working families. I know we talk a lot about folks who are unemployed or out of work, but this was really designed to help those working families who, like you just said, one illness puts them in bankruptcy and ruins things and makes them pre-existing now, and they can't get help and can't get future insurance. So it really is designed to help those folks get affordable care.
You understand I'm playing devil's advocate here.
Perfect.
Okay.
No,
And there will be lots of people that will choose
Yes,
that
I know.
route.
I mean,
that's a
Especially the
personal
first year at $95, there will be plenty of people that say, I'll pay the.
I'll pay
$95.
Yeah, I don't have that much, or they may be exempt. But again, that's why everybody needs to look at it and know their options to say, yes, 1% of my income, I'd rather pay that in a penalty than have insurance.
Okay, so I opt not to get insurance the first year, maybe even the second year. Do I get into exchange the third year?
Yes.
I can still
You
get
have
in?
to-
There's
the
open
wait
enrollment.
So it's open
There's open
enrollment.
enrollment every year, October to December.
October.
For the second and third year.
Yes.
This first year, you have 6 months so you can get in through 2014. So you have
Oh, I thought it was till January.
You
from
have
now until
December
January.
14th to get in for January 1, but you have till March 31st to actually get in to have coverage in 2014.
Okay, wait a minute.
Sure.
So we went from October to December 14th to get in by January 1st.
And
But then-
after that, if you enroll anytime between December 15th and January 15th, you'll be February. So it's a staggered enrollment, but the last drop-down dead date to get in for 2014 is March 31st.
Okay.
Yes.
And then what happens if you don't get in the first year?
Then you can open enrollment in October. Now, there are things that qualify to get you in the middle of the year. You can have family status changes similar to when you can get in and out of your group coverage. If
Okay.
you get married, if you lose your job, if your situation changes, if you have a child, things like that can help you get in the middle of the year
Okay.
if you didn't pick.
That's right. So
Okay.
if you elected not to take the coverage and decide come next June that, oh, I've got something that I really need to get covered, I want to take that insurance, you're not going to be able to have that option unless you have one of those qualifying situations that allows you to have a special enrollment.
Okay. What if, by the way, is dental coverage in this Affordable Care Act, or is it only
Just
medical?
pediatric.
It's pediatrics mandated, but I understand you can.
No. I
add-
meant the whole coverage, the Affordable Care Act. Is there anything? Is it all medical, or is there any dental involved in this as well? Is that not part of it?
My understanding is that there are dental plans that are being put in with some of the options that you can purchase if that's something you want. It's only mandated to be included for family coverage for pediatrics.
Oh, so dental is
So just
pediatrics.
for kids.
For kids.
For children.
Okay. So I've heard so many definitions of what child is these days that I'm not quite sure. So the Affordable Care Act if your child lives in your home beyond age 18, how far are they covered?
You can cover them till age 26 and they don't have to live in your house.
Okay.
They can be married, actually.
They can be
They
married.
can even be married
Right.
and be covered.
Yes,
Okay.
you just can't cover their dependents, but you can cover them.
So technically, we're confused about how we define our child,
That's right.
much like everything else on this planet. You know.
Do they ever stop paying your child?
I don't think they ever do, and I think
Yeah, they can work and vote, but they can still be covered
You're
under
16, you can
yeah.
drive, but you can't. I mean, you can go to war, but I mean,
Yes.
it's just we've got and 21 and 18. I mean, we just haven't quite figured out when adulthood begins and childhood ends in this country. So
I
it
think we had
seems.
so many kids coming out of school that couldn't find jobs and nothing, that this was a way to help and to put them on someone's plan. So It definitely is.
And so that's what the
And that's what
justification was.
And one
Yeah,
of the
and-
big target audiences for this too is also the young kids who are working part-time jobs, going to school at the community college, who don't have coverage because they're not working enough hours
And not going full time.
and not going full-time, but they can get themselves covered if they have parents who don't have options to cover them either, but they can get on their own plans with their own income.
Well, I can see that all of you women are really passionate about what it is that you do. I mean, it's just so amazing to me. You're both knowledgeable and passionate about what you do, and it's really, I mean, it's exciting for me
Can
to
I
see.
say one thing?
Sure.
None of this for taxes is 2013. So when you come in April, it doesn't matter for 2013. It's 2014. And I think that's an important thing, that it's 2014 when this is going to affect your tax return, because everybody's already kind of going, well, what do I have to do? Nothing this year. It's planning for us for 2014. And I think that's important for
Oh,
people to
thank you
know.
for telling
Yeah.
us
That's a
that.
good clarification.
Yeah, because I think everybody's kind of paranoid about the January 1st,
Yeah.
you know,
Yeah.
but what does that mean for me kind of thing.
Yeah.
So,
And like you said, we've been preparing. We had to start reporting how much we contribute to your insurance benefits on the W-2s last year for W-2s as an employer.
So-
And you'll see it
If
right
you're
on your.
250
You
or
should have seen
more.
it last year,
Yeah.
and you'll see it this year. But yeah.
Yeah, so we're starting to help contribute to that. Tracking's in place.
what kind of stories or scenarios have you been experiencing with people that, you know, might be helpful to exchange, you know, and let us hear about it? I mean, we heard about the 58-year-old lady, but are there any kinds of stories that might help us or benefit us that, you know, you came to, you know, some light bulbs turned on, or you were able to understand things more clearly? No? No. Not really yet.
It's still so new.
Still so new.
It's
I mean,
still
there are a
so
lot
new,
of people
yeah.
that are very excited about this option that may not publicly talk about it, but they're excited to see what they can do. We have demand and questions, and people want help. And so I'm encouraged by that.
Okay.
There's definitely people who want to see what it is for themselves and are starting to understand that. But I think getting the word out and making sure everybody knows that everybody needs to be looking at their options. Everybody should be informed about what's going on.
And we continue to have our eye on whether Virginia's going to decide to expand Medicaid, because that just from our perspective is really critical to get 420,000, you know, poor folks enrolled and,
Yes,
and
that'll be a
get
huge
them
benefit.
health insurance.
And that's from the legislative level?
I mean, the state has to decide to do that. And
Right.
lots
At
of
the
s-
legislative
yeah,
level.
lots of states have done that. Virginia hasn't done it yet.
There's lots of
We're
talk.
hopeful.
There's lots of talk about some reform and some changes that might happen if those reforms happen, but that's what's kind of keeping Virginia held back here.
Yeah, I mean, right now we've just left a lot of people out of this story and these opportunities, and so those are the kinds of things that we want to keep talking about until that happens.
So we do have, and we're lucky to have, and many places don't have, a free clinic here in Charlottesville and in the surrounding areas. Would anybody like to talk about what the free clinic is, to let people know, in the event that they are one of these people who falls in the crack, what that is for people?
I can address it a little. We're not with
Okay.
them. We don't have a free clinic. We have community health where people share in the cost of their care. It's just on a sliding scale fee, where the free clinic,
Oh, so you're a sliding scale.
we're sliding scale. We have 14 different areas around Charlottesville and the Richmond area. But so I can just
So
address.
you can address the people who fall in the cracks.
We do.
Oh,
yes,
okay.
we will, and we will continue to be there. But we address everybody. As I always say, regardless of whether you have insurance or not, you're going to come into our office and get high quality care. We just happen to have resources to help you if you don't have the
Okay.
financial resources. But we'll be there whether we're there if you have insurance or not. And so that's why, as counselors, we're more than happy to talk with anybody that we can
Okay.
to do that. But the free clinic will, there are some, issues coming for them. But there's still, with these people in the gap, there still will be a need for free clinics
Yeah, I wondered if they were going to be defunct.
and the community health centers. That's what we keep saying. Don't worry, we're not going anywhere.
Okay. Well, now that I understand, that we still have gaps in all of this, and that, it's a little bit less confusing to me here right now, and I really appreciate how the clarity you all have, in terms of explaining this, because prior to this conversation, I was completely befuddled on many of the different issues because I heard so many conflicting pieces of information. So we're going to go around just for a minute, and each one of you gets a minute because we're almost out of time here. And if there's anything you want to tie up or any comments that you'd like to make, feel free to do it. Mary?
Sure. I'm not sure I need a minute, but I would just say I think this is a really important opportunity for people who haven't had health insurance, and this can really change people's lives to be covered and to not have that kind of risk hanging over their lives. We continue to have our eye on protecting the poorest folks in the community, and we look for our government to do the right thing and expand Medicaid so that everybody is going to be able to have that option and these opportunities. And we look forward to helping people. Call our office. We'll be glad to talk to you.
Excellent. Dottie?
Well, from my perspective anyways, I encourage people to contact their local agent, whoever they're working with now, because they are able to help them sort through what the options are for them, whether you're an individual or you're a business. It's confusing. As you say, there's a lot of misinformation out there. I was actually sitting and getting my car fixed, and I was sitting there listening to one of the national networks, and there was 3 pieces of information that they were not quite accurate on. And I'm thinking, this is national network,
right?
And people are listening to this, and it's not quite accurate, the information that they were providing. So I think talking to the professionals, the navigators, is important to getting the correct information and how it impacts you personally, because everybody's situation is different.
Pamela?
I would say the same thing. It's being educated. Get as much information as you can from the right sources. But the political rhetoric aside, it's the law. Look at it and sit down and talk to someone about it.
Libby?
I would just encourage people to go and look at the marketplace, and just with the premium tax credits, a lot more people are going to be able to afford this program, and it's a good program for people who do not have health insurance. So don't just assume, that I'll just pay the penalty. It's the easiest way to deal with it. Look at what there is, look at the costs, look at the credits that you can get, and you might be surprised that it will be affordable for you.
Well, I hope you've learned a little bit about the Affordable Care Act today. You have been watching What Wise Women Want on Charlottesville Public Access Television, Comcast 13. And we have been talking about the Affordable Care Act from every single angle imaginable. If you need more information, you can go to our website, www.whatwisewomenwant.com, and Wize is spelled with a Z. You can find all of these ladies on our website, and you can get in touch with each one of them or get in touch with us at What Wise Women Want. Thank you to our panel tonight. Have a good evening, and thank you.